صباح الخير جميعا.
صباح الخير أستاذ.
شلون الشباب؟ زينين إن شاء الله؟
الحمد لله عين أستاذ، الله يحفظك.
الله يحفظكم. Today we are going to continue the fourth lecture for the postgraduate student. تاريخ يوم 19/5/2021. So at the beginning, today we have going assess, or we are going to have some information how we are going to make intraoral examination of the oral cavity. At every lecture, at the beginning, we are going to review the previous information that we have gained before. In the previous three lectures, we're concentrating on the following: the meaning of the oral medicine, the scope of action of oral medicine, the way that we are going to take a history, the importance of the history, and how we could make a diagnosis. This may occur through the extraoral examination and the intraoral examination. We go further regarding the extraoral examination, and we have a lot of information regarding if the patient have abnormal types of movement, abnormal smell, and what are the systemic diseases which is going to be alter the way of the diagnosis of the patient. And we know further information regarding the following: examination of the eye, if there is any associated system that may have an oral manifestation with the eye, the examination of the thyroid, clinically also, and we go further regarding the examination of the most important structure that always we concentrate about. It is the lymph nodes. And we know what are the alarming system when we are going to deal with these structures, when we have to refer the patient for further investigation. What are the characteristic features of the malignant lymph node? And we know further information regarding the drainage of the lymph node, taking into consideration other structures which is representing on the tongue, on the neck, in addition to have more information regarding the nail examination. So today we are going to have information regarding the intraoral examination of the oral cavity. So what are the general principles when we are going to deal with this subject? Anyhow, the presence of any oral mucosal lesion, whether this type of lesion is considered to be as white or red, and we know the relation between these types of lesion with the systemic involvement, whether this systemic disease is going to be associated with these types of lesion at the early involvement or at late, or sometimes the systemic disease may have its oral manifestation at the oral cavity at the beginning, then after that the systemic disease is going to be diagnosed. If we want to go further, example, patient with a Behçet disease, he may complaining from recurrent aphthous ulceration persisting for a long period of time with no any other manifestation. Like to say there will be no joint involvement, there will be no skin involvement. Then after that, this manifestation is going to be occur. Another systemic disease which may associate it with oral manifestation, which is starting before, like for example, the Crohn's disease. And here the recurrent aphthous ulcer is persisting even after the patient have getting type of a treatment. And many autoimmune disease, like for example, the pemphigus vulgaris, the bullous pemphigoid, the systemic lupus erythematosus. All of these diseases, whether it was genetics, whether it was autoimmune, most of them may associate it with an oral manifestation before any other type of manifestation is going to be occur. The same were applied for the Addison disease, we could demonstrating the presence of the pigmented lesion on the oral cavity before any other complication, like, for example, decrease the level of the blood pressure or the hypoglycemia of the patient. Again, another important things, the medication which is usually taken by the patient, and this medication may sometimes affect the oral mucosa. مثل ما راح نشوف, sometimes patient who is taking cyclosporine, or any patient who is taking methotrexate, any patient who is taking antidepressant type of medication, which is going to be decrease in the salivary flow, which is affected the sympathetic stimulation of the salivary gland, or patient taking antidepressant, antihypertensive, patient taking chemotherapy. All of these medication is going to be out of the oral mucosa. Further information regarding the age of onset and whether it is going to be increased in size, associated with pain, associated with bleeding, and sometimes associated with a necrotic tissue or fall-like smell, that is to say it smell. All of these principles may give us a clue how to make a diagnosis. Knowing the diagnosis of the oral mucosa lesion is very important to know which structure is considered to be as a benign, which structure is considered to be as malignant, and further investigation is required. This is the main aim of the oral medicine. هنا يقف oral medicine and this branch in order to make an idea, or in order to make a decision whether this types of structure is considered to be as a benign or considered to be as just anatomical violation, or it is need a further investigation. So knowing the normal structures is very important in order to know whether this is not considered to be as a benign. So one of the most important structures which is misdiagnosed, the Stenson duct, which is considered to be the opening of the parotid gland, and it is opposite to the maxillary molar. Another structure which is usually misdiagnosed during the examination, which is called the Circumvent Papillae, which is located at the junction between the anterior 2/3 and the posterior 1/3. Sometimes it is enlarged in shape. Again, the lingual tonsil, مثل ما راح نشوف, which is found on the posterior lateral aspect. The placa fibrosa, folds of a mucosa representing on the ventral surface of the tongue. جماعتنا الطلاب تذكروها البلاكا فمرباتا ولا لا؟
اي نعم استاذ.
منو جاب لكم اياها بامتحان؟
بالامتحان العملي.
ممتاز ممتاز، انا مكيف انه
اي نعم دكتور.
جاوبتوها ولا لا؟ منو مجاوب؟
كان اول سلايد.
الله ممتاز ممتاز. اذا احنا حققنا الهدف من الامتحان.
اي نعم استاذ.
نعم دكتور.
Okay. Okay. Another structures which is going to be represent like the fissure tongue, and here we could represent that multiple growths could be seen on the dorsal surface of the tongue, and another structure which is considered to be as octopuc-spacious gland is the Fordus granulus. And where most of the patients, they are attending to us, they're worried about this type of structures, and sometimes they make a biopsy for it. Actually, it is considered to be as a normal anatomical violation. Look, also, it is not representing only on the buccal mucosa, but sometimes the lateral ventral borders of the upper lip is going to be representing also. During مثل ما راح نشوف بالupper lip, this Fordus granulus is going to be represented. The varicositis also, which is considered to be as a large vein commonly seen on the ventral surface of the tongue. And when we are going to apply any slide, we could see on it, they could be blanch on a pressure. لا مانع انه اوقف هنا باعتبار I'm dealing with a postgraduate student. There was a two terminology which you have to separate between it. First of all, is the vascular malformation, the varicositis, and between the hemangioma. So what are the difference between these terminology? ما هو الفرق بالنسبة للفاسكولار malformation وبالنسبة للهيمانجيوما؟ هل هناك فرق بيناتهم? If there is any difference during dealing with this anatomical violation, or if there is any difference in the way of dealing في طريقة تعاملنا. حقيقة نمر عليها مرة بسيطة. الفاسكولار malformation هي group مال congenital blood vessels disorder. It is usually occur at birth، يعني birth mark تعتبر. وممكن أن تقسم إلى vascular tumor and malformation. And it is usually characterized by specific morphology and pathophysiology. Anyhow, the hemangioma is considered to be as proliferation of endothelial wall of the blood vessels, which is considered to be the benign type of tumor and most common vascular type of a tumor. Okay? إذا هناك فرق بين vascular malformation وهناك فرق بين الهيمانجيوما. حتى sometimes the way that we are going to deal with them. Well, most of the vascular anomalies or vascular malformation هي considered to be as abnormal vascular development وتكون أثناء الولادة. إذا من خلال الفاريكوسايتس here we could divide it into, or here we could make a distinction between the hemangioma and between the vascular malformation. And when we are going to examine the teeth, we are going to start with, when we are going to start with the examination of the oral cavity, we are going to examine the teeth. And first of all, sometimes there will be environmental factors, and these environmental factors could be virus, infection, toxic, or sometimes the patient taking chemotherapy or radiotherapy. And even though sometimes it's not related to environmental, sometimes it's may related to the genetics. So two most important factors which is going to be affected the congenitally missing teeth. One of them is genetic, the other is considered to be as the environment. And we know that the genetics sometimes it is considered to be as a dominant, a غالبة or recessive متنحية, and many factors is going to be affected. With dominant inheritance, my congenitally missing teeth, we are going to have two important terminology, the hypodontia or elgiodontia. And this terminology is actually related to the missing of the teeth, but let me have the difference between these two. The elgiodontia, it is considered to be very rare. ويعني ما أعتقد تشوفوها بحياتكم العملية, and it is considered to be as a rare developmental dental anomaly. And here the most important things we could demonstrating that more than 6 teeth is going to be missing. يعني من داخل الاكس راي ويطلب منك في بعض الأحيان أنت كطبيب مختص بالأورال ميديسن or any other branch يعطوك الأو بي جي ويقول لك describe the following condition. يجوز احنا نعطيك إياه مثلا فد اكس راي معين ويجوز انت مثلا تواجه في حياتك العمليه. If you are going to demonstrating that there more than 6 teeth or 6 teeth is going to be mixed سواء كانت في الupper او lower teeth, here we could describe that elgiodontia is going to be represented, while the hypodontia طبعا تعتبر ايضا developmental absence of one or more teeth. And the most important things when you are going أرجو أنه تنتبه وياي لأن أنت طبيب مختص وممكن أنه تكتب يعني تقرير في هذا الموضوع. You have to exclude it the third molar. يعني لازم من تكون الهايبودنشيا الثيرد molar ما داخل. You have to exclude it when you are writing any report. And it is one of the most common dental anomalies. Sometimes it is going to be occur in the primary teeth, and sometimes it is may occur in the permanent teeth. And in hypodontia, it is not only in the primary, it is sometimes occur in the permanent types of teeth also. And أكثر يعني teeth which is going to be mixed أعتقد هو second premolar والupper lateral incisor. النقطة العملية الأخرى اللي تفرق الهايبودونشيا عن الألجودونشيا، أولاً النمبر مال التيث بالنسبة للهايبودونشيا is mostly associated with many systemic disease involvement. يعني فقدان الأسنان sometimes it may associate it with many different types of syndromes اللي راح ناخذها إن شاء الله بمحاضرتنا السابقة. Syndromes may associate it with a missing teeth. Here we could differentiate it between the hemangioma and between the vascular malformation, demonstrating the difference between the hypodontia and between the algodontia أيضا. Another example of recessive inheritance اللي هو مثل ما قلنا الانسايزر hypodontia هو أكثر types of teeth is going to be affected. The supernumerary teeth sometimes are classified according to the morphology and the location. And here we are going to have some terminology. يعني من هذه الترمينولوجي سواء كان conical or tubercle, but يعني هي طبعا عندك 4 types مال supernumerary teeth is going to be represented. خلي اتكلم شويه عن الادنتوما لانه هوايه نشوفها في حياتنا العمليه و sometimes it is going to be discovered by a routine x-ray. The adentoma, anybody knows what's the meaning of adentoma? It is considered to be طبعا هي توضع ضمن التيومر. It is considered to be as a benign time tumor and it is related to the tooth developmental meaning that composed يعني dental tissue is going to be represented. And this dental tissue is going to be represented in irregular way discovered by X-ray. هذا هو الأدنتوما مثل ما راح نشوفه by the X-ray, while another supernumerary types which is sometimes need some hour management, sometimes need a surgical, sometimes may associate it with a vertical, associated with a surgical اللي هو اللي tuberculate. What's the mean exactly by the tuberculate? The tuberculate هو type هناك مال supernumerary teeth, more than one cusp or tubercle on the crown of the tooth, and may cause يعني mostly may associate it with impaction مال الماxillary central incisor. ايضا الكونيكال والسبلمنتال. أيد لحد الآن بصورة مختصرة we have some information regarding the anatomical violation. هذه anatomical violation sometimes related to the teeth, whether it was environmental, and the hypodontia and the algodontia, how we could differentiate between these two terminology. Again, how we are going to differentiating between the tubercle and between the adentoma. مثل ما راح نشوف هذا the tuberculate, more than one cusp is going to be representing. Other conical type. Look, the X-ray, it is going to demonstrating to me the adentoma. Multiple tooth structures is going to be representing on this area. The pellet is mostly going to be affected. Congenitally missing tooth يعني ممكن في الحقيقة إنه نعطيكم هذا السلايد. نقول لك describe the above condition. وممكن أن يعطى هذا السلايد and the age should be representing 13 years old, missing teeth with no previous history of extraction. How we could describing. نرجع إلى النقطة الرئيسية. If more than 6 teeth is going to be mixed or less than 6 teeth is going to be mixed. أيضا another things that we are going to investigating is the gingival, and sometimes the gingival is mostly associated with vitamin with the bleeding, and the most common type of bleeding may occur due to vitamin C or sometimes vitamin K, and we could demonstrating that in those types of patients who taking antibiotic for a long period of time, sometimes hormonal changes. And sometimes patient complaining from bleeding disorder, like for example, von Willebrand disease, hemophilia, and so on, even though investigating about the type of the medication, the liver disease also may influence because all the clotting factors is going to be formed. And here we could demonstrating in the liver that there will be increase in the level of the SGOT and the SGPT, in addition to prothrombin time is going to be affected. بالنسبة للgingival area مثل ما قلنا, medication sometimes may associate it with the bleeding. Taking the antiplatelet or anticoagulant even it is going to be affected. And sometimes we could demonstrating that gingival hyperplasia, and mostly occurred in the patient with epilepsy who's taking anti-epileptic type of medication, or sometimes cyclosporine may lead to that. And sometimes here we could demonstrating the presence of ulcer, and the dry mouth is going to be affected also. Here we could summarize the type of the hormone which is going to be affected the gum. The steroid, يعني endogenous secretion of the steroid is going to be affected. Estrogen and the progesterone, estradiol, chronic gonadotrophy. لنتكلم هنا عن الجنجفة شوية. Usually it is consists of the attached gingiva. Attached gingiva mal maxillary or mandible arch is usually examination by direct vision, and in attached gingiva always it should be repaired as the following: as it's cone pale, even it is have to be homogeneous in structures or homogeneous in color. texture مالتها ايضا يكون pink يعني ايضا pink in color, and tissue should be feel firm. That is to say, there will be no loose attachment and tightly attached to the bone. This is the most common typical finding. But sometimes in the gingival area, we could demonstrating some of the pathological changes. Sometimes there will be inadequate amount, that is to say, inhisar with gingiva, or the gingival recession sometimes is going to be occur, and this is mostly occur due to excessive paroxysms or a clenching of the surface of the teeth, or sometimes may occur by wrong brushing مثل ما نعرف. وبالحقيقة less than 1 mm of attached gingiva, it is considered to be as inadequate in most of the cases. And here we have to know what are the exact cause. By the mucogingival involvement, the area with no attached gingiva or area of extreme recession sometimes. Sometimes they will be associated with the frena problems, or even though sometimes we could demonstrating the presence of traumatic lesion. This traumatic lesion sometimes may occur due to the ulcer, abrasion, or burns. أيضا تعتبر gingival area يعني في كثير من الأحيان we could demonstrating the gingival, whether in the upper or lower. Sometimes it may associate it with an autoimmune disease. The most common autoimmune disease which is going to be representing on the gingival area is the lichen planus, which is considered to be as a mucocutaneous types of lesion. lichen planus أكثر شيء, and they specify the radicular types of the lichen planus. Mostly the erosive type is not representing on the gingiva, mostly occur on the Bachelor Mucosa and may occur on the pellet also. While the radicular types of lichen planus, it may give clinical features which is highly similar to the chronic periodontitis or gingivitis, وهنا أيضا المريض في كثير من الأحيان are dealing with as periodontitis case or gingivitis and start scanning and polishing whatever, but the problem is not relating to the plaque and other causes, but it's related to autoimmune disease. Another most important disease which may occur on the gingival area, we could demonstrating ulcerative area here on this area also. The pemphigus vulgaris also. The pemphigus vulgaris, which is starting at the oral cavity, gingiva, it is considered the early manifestation of the pemphigus vulgaris, and it is mostly starting on the gingival area associated with eroded and erythematosis, and the bullae is going to be ruptured within 24 to 48 hours and associated with pain. Another autoimmune disease which is going to be affected the gingival area is the systemic lobus erythematosus. Even though sometimes the gingival is going to be involved with allergic causes or allergic type of response, then we have to know the attached gingiva, the mucogingival fold, enlargement of the gingival area, the gingival, whether it is considered to be as a bleeding. We have to investigating about the previous thing, whether vitamin C or vitamin K, whether there is a liver involvement. And the gingival is mostly associated with an autoimmune diseases. Another area which is need to investigating by us is the Bachelor Mucosa. The way that we need to investigating or كيف يمكننا أن نسوي examination of the Bachelor Mucosa, and what are the most common types of lesion which may associated with it. عادة الإكزامينيشن مال البكالة ميكوزا نستخدم direct to indirect vision عن طريق both of our finger by the biodigital palpation of the entire area. Is when you examined the buccal mucosa, try to pull the tissue away from the retromolar area and try to stretching the area of the mucosa. And here we are going to use both of our fingers in order to palpating and pressing the tissue between the thumbs of one and between hand and the index finger from the others. How we could know that this considered to be as a normal tissue of the buccal mucosa mostly appear moist and dark pink in color, and no induration, and we could demonstrating the presence of stensin duct. This stensin duct sometimes is going to be identified with or without the presence of the parotid papillae. Most common types of lesion which may associated عندنا مجموعة من الليجنز اللي the most common type طبعا تعتبر traumatic injury, and this traumatic injury may presenting on the buccal cheek, sometimes may associated with the thermal burns, even though the most common is associated with a cheek bite. Another types of lesion which is representing of the buccal mucosa is the leukoplakia. Leukoplakia تكون على شكل whitish area presenting on the buccal mucosa. Even though more serious conditions sometimes is representing on the buccal mucosa, like for example the erythroplakia even, or speckled leukoplakia. طبعا مثل ما تكلمنا هذا الفوردوس granulus species gland mostly occur on the buccal mucosa, which is considered to be the typical finding. And here the patient may attending to you, he's going to be feel some of the small papillae within the tissue, which may give me indication about any sclerotic or fibrotic minor salivary gland. Sometimes varicositis or perforations of the endothelial wall of the blood vessels like a hemangioma also representing the buccal mucosa. ويبقى sometimes it may go to represent as leukodemia or white sponginovus. And the most common types of autoimmune disease, which is representing bilateral on the Bachelor Mucosa, is the lichen planus. طبعا يبقى هو البكالة ميكوزا هو البرايم اريا مال ستريس. And here we could demonstrating the whitish line along the occlusal surface. And sometimes the moroscotobacaram is going to be representing on the buccal mucosa. These the most common types of lesion. First of all, Fordus granulus, species gland, leukodemia, which is considered to be as a typical finding. The varicositis الهيمانجيوما ايضا موجوده على buccal mucosa, proliferation of the endothelial wall. وتعلمنا الفرق بين الهيمانجيوما وبين الفاسكولار malformation. ايضا peak bite for the moroscobacarams is the most common types of lesion representing on the buccal mucosa. Leukoplakia, and do not ignore if there is any neoplastic changes. Look what are the most common types of systemic disease. The oral lichen planus مثل ما تكلمنا سابق, and the most common types of the reticular type mostly occur on the buccal mucosa. Systemic lobus erythematosus, SLE, and sometimes even DLE. Sometimes we could demonstrating the processing of lipoma, ulcer, recurrent aphthous ulceration, and mostly the minor type, while the major type is mostly representing on the pellet, and the EM, erythema multiforme, sometimes may relate it to the medication, and the Crohn's disease. The early manifestation of the Crohn's disease may occur on the oral cavity as recurrent aphthous ulceration. Here some of the slide. Here we could demonstrating the Wackham Citraya of the lichen planus, which is going to be radiating on the buccal mucosa, mostly mucocutaneous types of lesion associated with the skin involvement. But the early manifestation is going to be representing the buccal mucosa, and more than 6 types of lichen planus is going to be representing. White sponginovus, it is a genetic and is considered to be as an autosomal dominant. Fordus granulus is also going to be representing on the buccal mucosa. Leukodemia, whitening or thickness of the oral mucosa is going to be representing on the buccal mucosa also. Another area which is need to be investigating is the pellet. What we are going to demonstrating in the pellet, what we are going to see in the pellet. First of all, let's know. خلي أول شيء البلت العفو نشوف الاناتومي. Let's see the anatomy of the pellet as a general talking. Here, the tissue is going to be representing as a hemogenesis, and it should be pale and pink in color, and it should be firm in palpation. This structure is called the incisive papillae, which is considered to be as a protrusion of the soft tissue lingual to the maxillary central incisors, which is going to be representing as red on the surrounding area. Another structures which is need to be noted is the roughly and the raphe. Here we could representing the raphe. Look. Here, slightly evaluated line is going to be extended from the incisive papillae, the soft papillae, الهارد إلى السوفت. هذا يدعى بالريفي. Another structures which is considered to be important during the exam is called the Roche. There will be corrugated lines radiated laterally from the rave. These considered to be as the anatomical structures of the pellet. What we are going to demonstrating in the pellet, نرجع عليها. Sometimes, or the most structures which is going to be representing on the pellet is, sometimes we could be demonstrating the Nicotinicus Dermatitis, and here will be slightly inflamed of the minor salivary gland. The here minor salivary gland, it is mostly occur in a patient with excessive smoking, Nicotinicus Dermatitis, which is to be whitening and fissuring of the attached gingival of the hair pellet, associated with mild or moderate inflammation of the minor salivary gland. Sometimes we could demonstrating the presence of denture stomatitis on the pellet also, which could be divided into 3 types. Denture stomatitis type 1 and type 2 and type 3. Type 3, it is mostly associated with a papillary hyperplasia, and we could demonstrating the presence of a finger-like projection, and mostly occur in a patient with a poor denture or ill-fitted denture. And sometimes it may associate it with systemic condition, mostly occur with systemic lupus erythematosus. Even though sometimes we could demonstrating the presence of pigmented area on the pellet. The most common types of lesion, Nicotinicus Dermatitis, papillary hyperplasia, عادة small projection-like structures نعتبرها ب type 3 denture stomatitis. طبعا هي denture stomatitis تقسم إلى 3 types. Type 1, it is just simple erythemia, which do not associate it with any bleeding when you are going to scraping it. Type 2, wild erythematosus area representing on the pellet. When you are going to scrubbing it, bleeding is going to be occur, while type 3, it may associate it with a papillary-like projection. Sometimes the thermal burn also, just to say traumatic, and even though the blue nevi sometimes is going to be representing on the pellet. These considered to be the most common type of the lesions: Nicotinicus Dermatitis, denture stomatitis, traumatic lesions, pigmented area, any pigmented area presenting on the oral cavity or multiple pigmented area. These sometimes it may need a further investigation, and do not ignore, because it is considered to be at the early manifestation of many systemic diseases مثل ما قلنا الأديسون وغيرها. Now we are going to have an idea about the posterior pharyngeal area. خلينا نطلع الصورة مالتها ونتكلم عليها. هذه المنطقة posterior pharyngeal area. The tissue in this area, should be appear vascular and homogeneous in color. Sometimes it may associate it with a reddish pink, smooth and small coral pink to translate it, like homogeneous like in surface. Sometimes it may associate it with ulcer, erosion, or even though if there is any enlargement of a growth. The posterior pharyngeal area mostly associated with a major aphthous, which is represented on the soft pellet. Sometimes it may associate it with traumatic ulcer also. This here مثل ما قلنا السلايد السابق we could demonstrating the major aphthous, mostly representing at the junction between the hard pellet and between the soft pellet, severely painful, and it's going to be interfere with eating. Another manifestation which is occur at this area is thrush candidiasis. It's going to be representing at the posterior area of the mouth. Also, it's associated with dysphagia and difficulty in swallowing, and it is mostly occurring in a patient with immunosuppressive. Therefore, further investigation is required for this patient. Then, another structures which is need to be investigating, posterior area, باوع الاناتومي مالتها. اكو هذا البلت. البليتلوجلوسال ارش واللي يكون قريب. لكن البليتلوفارنجيال ارش هو اللي يكون قريب من اليوفولو من التونسل. Then glottal and the platelopharyngeal arch. Two arches is important for us to diagnose. Glossal means that it is near the tongue. Pharyngeal is the deepest one, the platelopharyngeal arch. It is near the tonsils and near the alveoli. This is the hard palate, this is the soft palate, and this is the tonsils. How we could examine the tonsils? طبعا طبيب الأسنان يعني هو sometimes need to examine the tonsils. يعني هو مو يعني it's not his job, but as a general talking, the tonsils are examined using direct visualization, and here we could demonstrating the presence of lobular or coral. Sometimes it's going to be representing as a pink in color, and sometimes patient are يعني enlargement of the tonsils or large cryptus in their tonsils, and as a result of that, those types of patients may complaining from dysphagia, and even though there will be swallowing and the food is going to be acclimating, and as a result, the bacteria is going to be initiating in this infection. And the patient may attending to us may complaining from halitosis. Even though if the patient have been tonsillectomy, sometimes residual tonsil tissue or regrowth of lymph node tissue in this area may occur. And after making the surgical operation of the tonsillectomy, sometimes residual tonsils tissue or regrowth is going to be occur. And here we could examine the oropharyngeal area, ask the patient to say "oh," "ah," and we could demonstrating that, taking into consideration that most of the patients, they are complaining from gag reflex. هذا الكلام اللي تكلمنا عليه patent tonsils. The posterior pharyngeal wall and the alveoli have a slightly raised papilla and yellow area. It's what we call it the lymphatic tissue, lymphoid tissue. Enlargement of the tonsils. Sometimes it may associate it with a pathological condition, يعني dysphagia, and this may occur due to the post-nasal drops. يعني those types of patients may have a dysphagia or difficulty in swallowing, and as a result, accumulation of the bacteria is going to be occur of food stagnating area, and the infection is going to be initiating. And even though sometimes may indicate a nasal obstruction. The raphe with rouge with incisive papillae. This is the most common anatomical violations of the palate. And this is the Nicotinicus Dermatitis. The inflammatory or the infection of the minor orifice of the salivary gland, which is representing mostly occur in a patient with excessively smoking. And it is representing at the early stage as pinpoint hemorrhagic area. Then after that, It's going to be enlarged in size and associated with a whitish area. Pellet sometimes may associate it with red erythematosus area in Adentoma dermatitis, or sometimes infection or herpetic infection or systemic lupus erythematosus may associate it with that. Tori, مثل ما نعرفها اكو mandible tori, which is considered to be as a bone exostosis, and do not need any for example management unless it's going to be interfere with the insertion of the denture or eating and or so on. Sometimes we need a surgical operation for that. Another area which is need to be investigating, it is the upper labial mucosa and the lower labial mucosa. What are the most common structures, or what are the most common types of lesions? Labial mucosa, here we are going to use a direct vision, inverting the tissue over the finger or thumbs. This is the index finger, and this is the thumb. We are going to evaluating the upper mucosa. Then after that, we are going to use a biodigital palpation of the tissue of the lip. You have a visual examination, and try to move the tissue from one side to another. And here we could examine the frenum. Normal lip, how it is going to be appear? Normal lip tissue are homogeneous, deep pink in color, and sometimes it is changed gradually to deep red in color with more prominent vascularity, the bucolabial vascula. Always the labial mucosa, سواء كانت upper and lower, it should be representing as a moist and uniform constituent, and you are going to make palpating by both of your fingers. Sometimes minor salivary gland, which is going to be representing at this area, the area on هذه المنطقة, sometimes we need a biopsy and specify if we suspect, for example, the Jordan syndrome. We are taking a biopsy from the lower lip, and sometimes we could demonstrating the sclerotic minor salivary gland, even though the Fordyce granulus is going to be represented. And the pathological finding mostly associated with injury and mostly occur in a patient who is complaining from paroxysms or clenching on their teeth, or sometimes cracked lip in a patient who is complaining from vitamin C deficiency or malnutrition, or even though if the patient is taking medication. Another lesions which may occur on the lip اللي تكلمنا عليها بالمحاضرة السابقة اللي هي the angular colitis. How many types of angular colitis we have? Actually, we have two types of angular colitis, type 1 and type 2. The type 1, which is characterized by eroded erythematosus area representing at the angle of the mouth and does not extend deep into the buccal mucosa. While in a type 2 of angular colitis, here we could demonstrating the ulcerative area and the eroded area is going to be representing and extended to the buccal mucosa. Type 2 of angular colitis. Other things which is going to be representing on the lip, herpes simplex virus, and even though the candidal infection, that is to say sometimes there will be mixed infection between the beta hemolytic streptococci, and between the staph aureus and the candida. This is the most common causes of angular colitis. ولهذا أثناء العلاج it does not respond to only antibiotic, does not respond only to antifungal, because combination type of infection may associate it with the angular colitis. And we know the causes: decreased vertical dimension, excessive saliva secretion, whatever. Sometimes aphthous ulcer is going to be representing, even though the cancers of the lip or neoplastic changes mostly associated with the lower lip also. These are the most common: the traumatic, the cracked lip, the angular colitis, and we divide it into two types, and neoplastic or cancer also. أعيد بصورة مختصرة. We starting dealing with many anatomical structures. So knowing the anatomical structures is very important in order to know whether this is considered to be normal and abnormal. You have to know the most common types of lesions which occur on the palate, on the Bachelor Mucosa, on the lip, how we are going to deal with each one. And also the normal anatomical, سواء كانت هناك extension duct or circumvent papillae or the fissure tongue or enlargement of the tonsil and so on. Another area which is need to be investigating also is the floor of the mouth. And here we are going to use, طبعا the floor of the mouth is very important because the carcinogenic agent or the carcinogenic substance, they are pulling more in the floor of the mouth. تسمح لوقت كافي for any ulcerative area which is persisting in the floor of the mouth. في حياتك العملية, please do not ignore, especially if it is persisting for a longer duration of time. So, by a manual palpation, and here we are going to ask the patient to raise his tongue and direct visualization of the tissue. And here we have to know the normal anatomy of this area. Knowing the normal anatomy is very important to know whether this is considered to be as normal or abnormal. The sublingual carbuncle, small rounded projection. The base of the lingual frenum, which is houses the warthin duct, مثل ما قلنا الكانالز مال اللي open oral cavity الباروتيد هي الستنسن، السبماندبل والسبلينجوال عن طريق الوارثن duct. السبلينجوال طبعا لا، السبلينجوال تحتوي على مثل ما راح نشوف في محاضرات السليفري جلاند الاوبننج مالته شويه يختلف. يعني multiple ducts that are fused with each others. Sublingual folds to oblique elevation dating laterally from the lingual frenum. And the other structures in lingual frenum, which is considered to be as a frenum وهي muscle attachment من the ventral surface مال tongue to the floor of the mouth. Sometimes it needs a surgical operation. And we are going to use bimanual intraoral palpation of the index finger of the non-dominant hand. And we are going to feel these structures. The floor of the mouth, most important structures we are going to deal is the submandible salivary gland and the differentiation between the submandible salivary gland and between the lymph node enlargement. And here both of our hands is going to be used. One of them inserting on the floor of the mouth and the other from outside. And we could demonstrating if while structures is going to be continuous swelling continue with each others or separating. أنا بدي أعرف إنه هل هو السويلنج من السبماندبل salivary gland أو السويلنج من الليف نود الموجودة بالنك. ندعى بالبايو مانوال إجزاء. هذه الطريقة تستخدم البايو مانوال، نستخدم both of two hands to see whether we could compensating this swelling between two hands. يعني إذا كان السويلنج ممكن أن يحصل two types of finger between two of our index finger. By the examination, we could confirm that the swelling is related to the submandible salivary gland. While if there is a loss of the continuity of the swelling, there the lymph node is going to be swelling, not the submandible salivary gland. the better to be demonstrating it clinically, especially for other branch. وتدعى بالطريقة بالبايا manual intraoral palpation of our index finger to know the difference whether the swelling in the salivary gland or the swelling in the salivary in the lymph node in this area. عادة مثل ما نعرف submandible is located on the platoglossal types of muscles. Another anatomical violation, sometimes the ranula is going to be representing on the floor of the mouth, even though xylothysis, that is to say stone, is going to be representing. Sometimes it's associated with a mucocele, and one of the anatomical violations is considered to be as ankylosing. It is considered to be pathogenic only if it is interfere with the normal development or affected the speech or affected the eating. Again, neoplastic changes may occur at the floor of the mouth. Please try to not ignore any ulcerative area because مثل ما قلنا a carcinogenic agent is going to be pulling inside the floor of the mouth for a long period of time. Squamous cell carcinoma may occur at the floor of the mouth. Any whitish area, any hyperkeratotic area, it is considered to be serious during dealing with this condition. Ranula also. Okay. قاعدنا بالexamination. Another things to be examined. What tongue? Examination of the tongue. ما الطلاب ده يشوفون الصورة؟
نعم دكتور.
نعم دكتور موجودة.
طبعا الاكزامينيشن مال التونج هو بحده هو انتيتي كامل. هو بحده because it is considered to be as a manifestation of many systemic disease. المطلوب من عندكم بالاكزامينيشن of the tongue, developmental of the tongue, how it is going to be occur, and we going to have some information regarding the color, the texture of the size of the tongue also. والاناتوميكال circumvent papillae والفولت papillae وغيرها. طبعا هو انتيتي كامل. انا راح ادز لكم اياه الاكزامينيشن مال التانك نشارحه، بس الوقت هسه ما يكفي لان خلصت المحاضره ساعه وما نقدر يعني look the lingual varicositis, الباكافامبراماتا, how it is going to be representing as attack-like structures presenting from the ventral surface of the tongue. varicositis ايضا حادز لكم ان شاء الله we are going to clarify the examination of the tongue in the details. Okay. هنا خلصت الساعه. If there is any question اعتقد رابط الحضور بنزل لكم اياه مو؟
نعم دكتور.
والعفو سجلتوا بي لانه راح يقفل بالعشرة.
تمام استاذ سجلنا.
تمام.
سجلتوا عيني؟
اي نعم استاذ.
Okay, if there is any question.
العفو دكتور، ماكو رابط مال الحضور.
دكتور ماكو الرابط.
موجود بالكلاس عيني موجود.
موجود لا
لا عفوا نزل فتحوا على الكلاس مرة ثانية وسووا له ريفرش مثل الكلاس تلقون دكتورة فريال داز رسالة جديدة.
دزتها دكتورة فريال.
اي
صباح الخير دكتور.
هلا دكتورة فريال. هلا ليش عيني؟
الرابط الحضور موجود بالمسج مال الميتنج وموجود بالكلاس روم. هي مطلوبة الحضور اليوم للوزارة ترى، فخلي يسجلون كلهم قبل ما يطلعون.